All right, hello everyone. So today we're going to be talking about intro to test selection and administration. So how to select the proper test for the fitness test you are trying to assess, as well as how you would begin administering those tests before we start getting into the different types of traditional fitness tests that are out there. Okay. Okay, so our lecture for objectives today are to identify and explain reasons for performing these tests, understand the testing terminology used to communicate clearly with athletes and colleagues, evaluate a tester's validity and reliability, should be a review for you guys, and how to select appropriate tests and then administer test protocols properly and safely. Okay, so let's hop right into it. Let's do the reasons for testing. So when we want to assess athletic talent, what are the three main things why are we doing this type of testing? Testing helps athletes and coaches assess athletic talent and physical abilities, along with areas of needs of improvement. So not only do we see where their baseline is and where their physical abilities are, we can actually point out areas of needs of improvement as well. 2, this allows coaches to set specific goals for individual athletes that help to accomplish group or team objectives. And 3, provides a way to determine if a candidate has the needed basic physical abilities that, in combination with technique training and practice, can produce a competitive player. So my last one is pretty much saying that does this person or individuals have the capabilities to perform the tasks of which the team or which the sport demands on themselves, right? So this is where you get into, like, should this person be on the team, not on the team, and all of that other stuff. All right, so let's get into reasons for testing. So we want to identify physical abilities and the needs of improvement. We want the appropriate testing measures and analysis can determine which physical qualities of an athlete can be targeted and prescribed in exercise programs. We want to make sure we set goals, and we want to evaluate progress. So baseline testing is very, very important for most athletes and most people starting a fitness journey, whether you are starting someone who's in the aging population who wants to enhance musculoskeletal fitness and endurance, from someone who is a high performance athlete, right? Everyone kind of needs to be treated the same as themes go. So we need some baseline testing in order to assess where that person is based off of what the goals or the sport demands of themselves. And then we set the goals from there. And then along the way, we will evaluate the progress. Okay, so let's get into some key testing terms. A lot of these you should know and are probably almost a review from Intro to Exercise Science that we went over, that you've gone over in that class. So key testing terms. A test is a procedure for assessing ability in a particular endeavor. In this specific realm, it's fitness testing. A field test is a test to use to assess the ability that is performed away from the laboratory and does not require extensive training or expensive equipment. So a field test is more practical. So if you're going to test a soccer player versus putting them on, if you want to do a test speed and agility, you can put them on the treadmill up in the lab, but that's a laboratory setting. The best choice in that sense would be put them on the soccer field and do the testing there, because they're in their environment and that's where they're going to be performing their sport. So that's just another hint as we go along. Measurement is the process of collecting test data. All right, so let's look at what evaluation is. This is the process of analyzing the test results for the purpose of making decisions. So i.e., another example would be making the decision whether or not someone's going to be on the team or cut. Do they have what it takes for the most part as regards to physical and sometimes mental capabilities? A mid-test is a test administered one or more times during the training period to assess progress and modify the program as needed to maximize the benefit. Okay. A formative evaluation is this periodic reevaluation based on those mid-tests, administering during the training, usually at regular intervals. And then a post-test is a test administered after the training period to determine the success of the training program and achieving the training objectives. So at the beginning of the training program, if your goal was to let's put a basic one, that you want to increase someone's VO2 max by 10 10 milliliters per kilogram per minute. At the end of that 8-week training period, you would test the VO2 peak at the beginning and then VO2 peak at the end to see where, and then you would compare the differences from where they started to where they were. And if they did go up 10 milliliters of oxygen per minute per kilogram, then you can successfully say that yes, your training program worked. Okay, so that enhanced that person's physical capabilities based off of your goals. All right, so when we get into test quality, there's main terms that are going to come up. You'll have in research methods, if you're not already in that right now, is validity and reliability. So remember, in validity in general means the degree to which a test or test item measures what it's supposed to measure. So is the test measuring what it's supposed to? This is one of the most important characteristics of testing. So for example, to put it in the most basic terms, if you want to test someone's aerobic capacity, would you be having them do a squat test? No. So that isn't testing what you want it to test. So make sure you are selecting the correct test in order to measure what you are intending to measure. All right. So some of these other terms should be popped back up. This should be a review for you. The ability of a test to represent the underlying construct. So the theory developed to organize and explain some aspects of existing knowledge and observation. That's something called construct validity. Face validity is the appearance to the athlete and the other casual observers that the test measures what it's purposed to measure. So again, is it measuring what it's supposed to be? So does it have face validity? So that example that I just used would apply here. Content validity. This is the assessment by experts that the test covers all relevant subtopics to the test or component abilities in appropriate proportions. And then criterion reference validity is the extent to which test scores are associated with some other measure of the same ability. So can we reference the test that you're testing to another type of test, right? So if we wanted to, let's say we wanted to assess local muscular endurance, we could do the push-up test as well as the sit-up test. They are both assessing muscular endurance, and can those two tests be related to one another? Concurrent validity is the extent to which test scores are associated with those of other accepted tests measuring the same ability, so just kind of what we said. Predictive validity is the extent to which the test score corresponds with future performance or behavior. And the discriminant validity is the ability of a test to distinguish between two different constructs. Okay, so we're distinguishing between two different constructs there. All right, let's move on to reliability. Again, this is just a review, so we're going to quickly go through all of these terms. Reliability is a measure of the degree of consistency or repeatability of a test, right? So I'll say that again. A measure of the degree of consistency or repeatability of a test. So can we do this again? So would we get similar results if we tested it once, twice, 3, 4, 5 times? If it doesn't, then it has terrible reliability, then you shouldn't be using that test to test multiple athletes or even the same athlete multiple times over. So reliability of a test may differ between groups based on differences in physical or emotional maturity and skill level. And a test must be reliable to be valid because highly variable results have very little meaning. All right, let's continue on. So measurement error can arise from the following type of situations. Intra-subject, within-subject variability. So even if you yourself are, let's say, doing a skin fold measurements, but you're not trained on how to take skin fold measurements, you may get a skin fold of 20 millimeters and then the next day get a skin fold measurement of 25 millimeters. Now that means that that skin fold shouldn't have changed that much from just a 1-day period. However, you got a big difference or from trial 1, 2, 3. So it's important to be trained on certain tests that you will be giving. Lack of inter-rater between raters reliability or agreement. So inter-rater within raters variability. So from one person to the next, you might be getting 2 totally different scores, and that's also not good. And failure of the test itself to provide consistent results, so the test itself. All right, let's review some of these concepts again. The intra-subject variability. That's the lack of consistent performance by the person tested. So just like I said before, when we're doing that skin fold measurements, if they're not trained on how to use that device, then what would happen is inter-subject variability would occur, and then the test results would not be consistent. Inter-rater reliability, the degree to which different raters agree, also referred to as objectivity or inter-rater agreement. And that inter-rater variability is the lack of consistent scores by a given tester, or the intra-rater variability. Okay, metabolic energy system. Let's talk about the test selections now. Right, so we just talked about that we want a test to be valid, so we want all of those validity terms to occur, meaning is the test pretty much testing what it's supposed to be testing. And 2, reliability, is the test repeatable and is it reliable? So could we use this multiple times over, and is it measuring what it's supposed to measure? So we want a test to be valid as well as reliable. So now let's head into test selection. Then let's talk about metabolic energy system specificity. So this is see how this is all kind of topping onto one another. So when we talked about the metabolic systems and the demands on the metabolic systems, an aerobic athlete versus an anaerobic athlete, the different energy system used, now this is going, all of those key terms and foundational knowledge is very important for you to understand to going into test selection, right? So for example, we wouldn't select a test if you want to test someone's sprinting capabilities, you wouldn't choose a 2-mile test to do that. Right? So now it makes sense. What are the demands of the athlete? And then you're going to choose the selection of the test based on those demands of the sport or the activity. Right? So we're going to consider the energy demands, the phosphagen, the glycolytic, and the oxidative of the sport when choosing these tests. When we move on to biomechanical movement and pattern specificity, the more similar the test is to an important movement of the sport, the better. So for example, if we're going to do an agility test coming up, what kind of sport requires a lot of agility? So sports such as tennis, soccer, where you're cutting quickly or sprinting and cutting and changing directions, lacrosse, all of those, certain agility tests would be applied during this type of athlete's testing period because it's applying most to their sport, right? So if you wanted to test, a tennis player's, agility and speed and footwork for the most part, you would choose the tests that are most relatable to that sport. So would you be testing, their 2-mile aerobic capacities? You might, if you wanted some baseline of their aerobic capabilities to last an entire match. However, if you're looking specifically at footwork and those type of movements, you want to also include those type of specific tests. Okay, so here it's very important to note, for a test to be valid, it must emulate the energy requirements and important movements of the sport for which the ability is being tested. Okay, so I'll say that it's really important again. For a test to be valid, it must emulate the energy requirements and important movements of the sport which ability is being tested. Again, right? So if we're doing some sort of agility, quick sprinting, and if that really requires the phosphagen and anaerobic glycolytic system, are we choosing the test that is going to be testing 1, those systems, and 2, those sport-specific movements of cutting back and forth? So we want it to be testing the energy demand side as well as the physical movement and the biomechanical side of things. Okay, so we're continuing on to the other test selection variables that we'll be talking about. We need to take into consideration experience and training status of the individual or the individuals that you are testing. So you are going to consider the athlete's ability to perform that specific technique, and you're going to consider the athlete's level of strength and conditioning, and strength and endurance and conditioning training. So you have to know what type of athlete are you dealing with. Are you dealing with a collegiate athlete, D1 athlete, professional athlete, or are you dealing with someone who just wants to get back in shape and has not performed any sort of physical activity over 6 months? So you need to be relating all of your tests and your measurements to the population at hand. Age and sex. So both may affect athletes' experience, interest, and ability, right? So depending, again, we talked about this, the aging population might not be interested in doing some uphill sprints and squat and deadlifting. They want to do some enjoyable activities, maybe some golf, some walking, swimming, these type of things. as well as males and females still do have different interests sometimes. Not all the time, but sometimes they may have different interests as well.